So I'm going to go ahead and get started. It's 9 o'clock. I'm going to bring up my presentation here. All right. And by the way, please feel free, if you ever have a question, unmute yourself. Feel free to just jump right in. This is really, I hope, a time for us to gather, to reflect, to think about different things that we're doing, and to get ideas from you, things that you learned this year that would really be useful to have. I hope we're a step ahead of you, that we're already filming and building a lot of that. And I think you'll see that we have a lot of good stuff coming, especially on the neuro and pediatric side. So just as a reminder, this is being recorded for faculty who are off on vacation. So I just want to let you know that it is being recorded. I have been at APU for about 18 years now. I am a teaching and learning fellow at the university. I chair the IRB, and I've spent a lot of my time actually in ortho. So a lot of these apps started in ortho as I was testing, how could I make my teaching more effective? How can I help students learn better? And then shortly after the ortho apps came out, my late and wonderful friend, Kathy Kumagai-Shimamura, she said, hey, Mikey, we should build apps for neuro because that's what I teach. Ortho doesn't get all the love. We got to do things for neuro. And so that began a new journey of a bunch of new cool apps. And actually, by the time we're done at PhysioU, we will be quite neuro heavy. We're filming a lot of really important content that I think will help our students learn how to treat patients better. And so my residency and fellowship training are all in orthopedics. I teach at the USC Spine Fellowship using these apps to help implement research. And the last 7 or 8 years, I have been working with some brilliant technology type people to help us build really cool interactive experiences for students that I think bridge the gap from what we teach to that elusive patient-centric experiential learning type of experience for the students. And so I hope you will begin to see where we are going with a lot of the things that we are creating. I want to just also acknowledge a close friend. She passed away this year. A brilliant professor, actually, and a visionary. She is one of the NeuroExam App authors. This is my good friend and colleague, Catherine Kumagai-Shimamura. And we spent a lot of time thinking through the NeuroExam App, along with Rachel Tabak Tran, who is now at the City of Hope. She was part of the neurologic residency at Rancho Los Amigos, or actually at Casa Colina. She did her training at Rancho Los Amigos and USC. And then now she is running the oncology residency at City of Hope. Mary Hudson-Mckinney, we have been filming a lot with Mary. Mary is a veteran professor, as well as her trainings, I believe her DPT came out of USC. And we have filmed her doing evaluations and treatments of a number of different neurologic patients. Out of all of those videos, we are using them to create many cool interactive experiences for students to go through. A lot of it that she's done, I really hope will really jumpstart the clinical reasoning process. It will allow students to see into the mind of a certified specialist and go through the process of evaluation and treatment for multiple neurologically impaired patients. Another cutting edge leader in the profession, I believe, Sara, brings the Neuro Rehab app. And she is also busy filming a lot of patient scenarios. So you'll see in the content that I'll show you, not only are a lot of the interventions for neuro, so we have a NeuroExam app, we have a Neuro Rehab app, so the intervention side, along with scenarios, patient cases that she's developing. And we will be also releasing, in partnership with MUSC, a bunch of interactive evaluation and treatment cases that you can deploy in your classroom to allow students to actually play through an evaluation experience. So very similar to what Mary and I have been building. Jayna from Drake, we've worked closely with her as well, along with our RPT the PT in our department, who is the ped specialist, we're filming pediatric interventions. So we're bringing in children and we're filming a common list of pediatric interventions that can be utilized in the classroom to help students see what are some common interventions that you might use on patients developing at different rates with different developmental issues. And then Charlotte Chatto, I think she has just retired from Augusta University this June or July. And we're bringing to you a really cool interactive neuroanatomy, 3D neuroanatomy app that will be coming out before fall. We'll have the first version available for you to check out before fall. And then developmental milestones. This is Dr. Melissa Cole. She is the one who we filmed the same baby every month of the first year of his life. And she would be there kind of making sure that we could showcase the different things that the child is doing as they're developing month by month. So really a cool project. She is part of the developmental, or actually the pediatric interventions app as well. And then just to make a note that we have a strategic partnership, our partners with JOSPT. I have long envisioned this, and I'm excited that JOSPT has the same vision, that research can be better implemented when really good video content comes alongside the research articles. So you won't have to guess anymore what tests and measures, what interventions were done. PhysioU will provide videos for that. So that's an exciting development for us and for JOSPT. Okay, so I want to take you in to learn a little bit more about the neuro apps that we have and the pediatric apps that we have, and also to give you a glimpse of what's coming in the future. So this is the NeuroExam app. And I want Mary actually to share with us how she was using the NeuroExam app in our classroom this year.
Okay, so if you go into the PhysioU app, what you're going to see is in the NeuroExam is a variety of different areas. And one of the areas that I love is the balance area. And so we'll look at doing a variety of these tests through the semester. And so there's a huge amount of standardized balance tests. And I've tried it in a variety of different ways. I have taken all the balance and just done all balance all the time. And then what I found there is students really lacked an understanding of when to use which test when for the specific diagnoses. So I changed it up a little bit. And let me know if you can see this. And so what I did is I subdivided it out. And so the very second week of my class, I have a lab handout where I'm looking at the simpler aspects of the balance test. And so this is the general balance grades: Romberg, sharpened Romberg, 5 times sit to stand, functional reach, multi-directional reach, and then single leg stance. And so all in this one lab, we're having the students look at these very, very simple balance tests. And so I've got the goals of what I want to accomplish, how they're going to be doing it. And then I basically have set up a sheet where they're basically going to be describing back to me how they complete these different tests. What are the positions that you perform the Romberg and how many seconds do you do it? What about the sharpened Romberg? What about the 5 times sit to stand? What are the cutoff scores that would indicate a person that's a fall risk? What are the implications of results with a functional reach? And these are all on the PhysioU app that your student can go ahead and access. So it's something that they're actually doing on their own. You're giving them an ability to have a little bit of autonomy in terms of generating this information. And then in the multi-directional reach, what's the average normative value? And I pick out, there's a table that's in there, a mean age of 74. What would you expect at these different reaching capabilities? And then in single limb stance, what, you know, with these age brackets, what would you expect eyes open? What would you expect eyes closed? So they really get an appreciation not only of how to do the test, but how to interpret the information relevant to their patient. And that's huge. That's the step that we want to take our patients to. So this is the second week of my class that they're taking a bite out of the apple with all these different balance measures.
So Mary, would you just pull up one of those tests, like single limb stance?
Okay.
And so they would actually go into one of these, click on it, view the test,
and then down at the bottom is normative data.
Wow.
So they down at the bottom, they can go ahead and look at how they can apply that information. It's all embedded on that link.
Got it.
And so it really is, it's making them not only learn it at a cognitive level, but it's getting them to learn it at an interpretive level. So you're looking at a higher Bloom's taxonomy. And what you're wanting them to do when you get them to the point where you're doing lab practical exams, or that they're stepping out into the clinic, or that they're taking the state boards. It's really preparing them for that type of a situation.
So what I really appreciate about that is what you've done is you've invited them into the resource, and the worksheet creates context. So as they walk themselves through these different tests, you've given them key things to look out for. Tell me about how the test is performed. So they look through the app, they fill it in the worksheet. Tell me how you would interpret this test. They look through the app. And so you're turning what could just be a blind wandering through the app into a very context-rich experience that not only unlocks the value of the content within the app, but creates context so that the students can better apply it, better interpret it, and then transition into the clinic, which I think is one of the big issues we all face. Is we keep teaching all of these techniques in the absence of context. And then we wonder why they're having such a hard time applying it when they finally get out into the clinic. So I think that's great.
Mm-hmm. And then I also sync it to your exam questions could come from not only the lecture material that I lecture on, but maybe the lab handouts are open fodder as well. And so that makes them really kind of recognize that they're developing a study tool for when they prepare for their midterm exams. And so it ends up being kind of a rich experience for the students, I think. At least I think so.
Yeah, that's great. So they go through that worksheet in the second week of class, partly as a way to learn about balance. It's an intro to balance, but also as a way to explore the resource. And I know in a bit you're going to talk about how you integrate that into the virtual patient days as well. I mean, this is a stepping stone. It's not just here's all the balance tests and then boom, you're into the virtual patient day. It's actually a bridge towards the patient day.
Right, it's scaffolding the student's learning experience. So, so my expectation early on is I teach the easier balance measures. And then as the semester goes on, so for example, this is the handout that I might have developed for, I think this is the, yes. So this is the vestibular week that we do. And so this is looking at the vestibular concerns. A piece of the vestibular concerns is knowing how to do the ocular testing, as well as balance testing. And so a lot of these measures are again on PhysioU. And so I'll have link backs to the PhysioU app, so they can explore or review how to do an oculomotor exam, how to do a vestibular exam, and then understanding how to complete this. And then I basically link it to the neuroanatomy.
Yeah.
Could
you click on that link real quick?
Yeah.
So basically you're linking some of your lecture content and the pathoanatomy and the anatomy, and then directly into the testing procedures that they will review and that they'll learn to do on each other in lab.
That's right. And so it just links right to the area that they need to do, and they can go ahead and examine each of these different aspects, and then further explore the content. So this takes them through a series of questions, and then this is looking now at the balance component. So in the PhysioU videos, some of the balance tests that I have the students learn would be the functional gait assessment, the dynamic gait assessment, the modified CAT-SIB, even the Berg. But the Berg is more the others,
right,
for the vestibular. So if you link into this then takes you right to the balance link, and you can go on in, and there's the modified CAT-SIB, there's the DGI, there's the FGA. So they can link right back to the PhysioU app and be able to explore these, and then practice them with their lab partners and get a better understanding of these different components.
That's awesome. That's awesome.
And then I do, it's a hot topic right now, yeah. But I do teach the neuro facilitation, the neuro intervention.
Yes.
So I do labs on NDT, PNF. I do a one-day lab on RUD. And so what I love now is I've been linking to when I do the PNF, I do 3 days of PNF. I link to the techniques, the patterns, the functional implications of it. And then there's a wonderful case study here of a person with Parkinson's disease. And one of so my homework assignments that I give the students are synced to what the lecture and the lab information. And so my PNF week, the end of that week, they look at a patient case that's basically this patient case here. And they're to come up with intervention strategies using PNF to go ahead and explore modifying and improving his balance and mobility concerns. And so the case is actually wonderful in here, and you can utilize this as kind of an idea.
That's great. So let me move on here. So
okay,
one of the things that I want to mention about how Mary is using the app is that you can use it in its simplest form. Here where I said augmenting your labs with high definition video. Previously, Kathy,
what you see is your typical neuro lab.
Kathy would use this lab handout, and instead of just being a blank sheet of paper or a sheet of paper with just a bunch of names, you could easily go in, and I'm going to show you here. You could easily go in. Let me get out of this presentation, take you to how you actually add these videos. You basically can go into PhysioU. So I'm going to go to PhysioU. And you will see that there's this educator faculty resources. In the educator faculty resources, there's a master video cheat sheet. This master video cheat sheet will take you basically to this document here. And essentially all the videos within our apps are all here ready for you to hyperlink. So let's say you went to, here's developmental milestones. Here is Neuro Exam. So here's the Neuro Exam app. And you can always just do a Command F, and you can find timed up and go. You would copy this link and paste it right into your lab handout. So that's what you're seeing. Now, there are a number of ways you can do this. Certainly, you could just log into the app. If you log into the app and you go to an area, let's say in the NeuroExam app, you want to look at tone, you want to look at spasticity testing. Here's the modified Ashworth. You want the students to watch that. you can grab this URL and link it to your lab handout. And automatically within, whether it's your LMS or your lab handout, the students now have videos that they could go in and watch even before class begins. This is one of the powerful things that I think having videos of just about all the neuro exam and all the common intervention techniques that they can watch before class really allows them to prep and actually helps them receive the information when they're actually practicing in class. They can receive it better because it's not their first exposure, and they always know that they have this resource with them when they're practicing and when they're out in the clinic. So there's a couple different ways for you to access this. The master video cheat sheet, or just by going into the app, finding what you want, you can always search through here as well. So here's timed, and it should bring up timed up and go. Okay, so there's a lot of different ways for you to get to techniques here. That is the first way. The second way that Mary is demonstrating is she is going one step further beyond just actually showing techniques on a lab handout. She has created worksheets, and the worksheets allow the students to delve that much deeper into the app or into the resource. And as I mentioned before, it is very valuable, not only for the faculty member on a weekly basis to open up the app and navigate the app, help the students see what is inside the app, help them find things. That creates a use pathway that helps the student really leverage the resource better, because there's so many things inside the app now that the more that the faculty use it, the more the students end up understanding how to use it. So I think that's one key point. And then the more you can integrate these videos into your worksheets and lab handouts, the more powerful those worksheets become, because they're not just passive. They can always go into the app and explore. It's a balance between giving them challenge, meaning here's questions that I want you to answer, here's context that I want you to delve into, and then exploring the resource that helps pull the answers out of the resource to meet the demand of that worksheet. So those are a couple of easy ways to utilize the PhysioU
So what
app.
you see is your typical neuro lab.
So those are
So what you see,
those are a couple of the easy ways to use it. If you think about how we've been using it for motor skill training. So this year it was particularly tough with not having a lot of face-to-face time or abbreviated face-to-face time. In our neuro labs, in our cardiopulm classes, in our ortho classes, we had the same pattern. And that was students were expected, they had their lab handouts inside their LMS. They were expected to preview that lab handout before they came to class. And when they previewed those tests, those measures, they would either try it on somebody or mentally visualize it. So we're engaging them prior to their first real exposure in the classroom. When we finally got to class, they have already looked through the lab handout, watched the videos, tried it mentally or physically. And now when we got to class to demonstrate these techniques again, we either use the videos in class, and for the more challenging ones, more challenging techniques, we then went live either on Zoom or on FaceTime, and we basically demonstrated techniques that way. The students reported that it was so nice to be able to preview techniques ahead of time. And lastly, I would say we did what we normally did face-to-face, we did virtual checkoffs. So the students would have a checkoff list of key techniques we wanted them to practice and perform well. This was in preparation for the final exams, the final practicals, and they would meet online for 20-minute to 30-minute sessions with TAs where they were demonstrating these techniques. So I think what you can see here is that when you have organized high quality video resources available, you can actually expand the window in which the students are exposed to these motor skills. And I think that really helps students learn better and deeper. Any comments or thoughts about that, or anything that you guys did this year that helped with motor skill training in a very difficult learning environment. Any thoughts from anybody?
Mike and Jim, this is Elaine Wilder. First of all, I want to commend all of you who have been teaching this past year. I, on the other hand, have been planning, and I'm proud to report that we have started our third week of our new Doctor of Physical Therapy program. Yay.
Yay.
So with everything going on, I mean, our building, we have to go in and out every day and take everything with us because the building is not finished, but the students are being great. And I cannot wait to use your many options. Many of our faculty now, cardiovascular and pulmonary, orthopedics, and then myself, I'll first teach in human development, but I am thrilled and jealous that I didn't have this many years ago when I was struggling.
Right.
Would love to have had these options. I mean, our students learn in so many different ways that having these previews, the imagery, et cetera, this is going to be great. Unfortunately, we've just gotten the mandate that we're going to be in masks for I don't know how long, because in Oregon, we have a lot of problem with people getting vaccinated. So we're going to be in masks and in pods and all for a long time. This is going to be a really powerful set of tools for us. So I just want to thank y'all.
Yes, thank you, Elaine. Yeah, I would say that's happening with us here in Los Angeles as well. And the beauty of it is that you can still run an A game, meaning they are going to come learning with really good videos. These videos, if we're all in pods, it's really hard for them to see me. So sometimes for some techniques, I just pull it up on the screen and I use it as a template so I can speak into extra little things that I would want them to watch out for. It is a very welcome relief sometimes to not have to perform every single technique nonstop for 5 hours, which is my lab periods. So I will intersperse the use of these videos. I have all 72 students in their 5 different pods, and they're watching either me live, or sometimes I'll just pull up videos. I'm happy to use the videos. The students are very accepting of it and very willing, because sometimes it's easier to see when the videos are well done instead of just watching through the phone. So
the other comment, Mike, this is James. I'll say when I was teaching our large class sizes, I'd have 3 and 4 labs, repeat, subsequent labs. And if you have the video, you know for sure everyone's got the same information standardized. And there's times in my 3rd lab or 4th lab going, oh, I don't know if I covered this yet or for what I said. And so I think the videos then keep a kind of a nice default, kind of make sure everyone gets the same material. As you go with the smaller groups, you may have to do because of the masking and pod type thing. It really can help reinforce that you make sure everyone gets, the information, you don't forget something.
Right. And I would add one other thing, and that is when you're in pods and you have instructors in each room, I have very strictly told all of my my other instructors, we are going to follow the videos to a T to minimize the conflict between everybody's little experiences and everybody's little different ways of doing things, which is fine when you get out into practice and you are developing your own skill and your own bias to how you want to do the techniques. But when it comes to grading at the end, it's a mess if you have 5 different instructors sharing little nuances about how they do different things. And so we have agreed that it is in students' best interest, and in the end, our own best interest as faculty, that you standardize to a standard, to the video. The same video they watch before class is the same technique that all of my instructors are viewing before they come to help out in lab. I hold them to it tightly, because the last thing a student needs is to hear that an instructor is doing something different. It undermines their confidence in the system of learning. It creates ambiguity. And so this is something that we did this year. I mean, think about ortho, how many little different ways people want to do their manual therapy techniques and special tests. It can be a royal mess if we don't standardize carefully.
And it also, Mark, the thing is that And that's for the teaching and for like board exam. And PhysioU is not this omnipotent group that knows all the answers for everything. I mean, students go out in the clinic, they go, oh, my CI did it a little bit differently. Good. Learn how they do it, learn the value of it, and move on. I mean, and that's why we practice physical therapy and not perform it, because we all may have subtle idiosyncrasies that we do in our clinical practice. But for education testing purposes, students want that. This is how you do it, and it's how you'll be tested for now.
Right.
Things. So yeah, but
Right.
so that's why you can't just say, go watch the videos, I'll test you at the end of the term, see you later. No, there's a lot of input that the instructor needs to add to the students and stuff. So
Right. So here, one of the things I want to share with you about, which is a lot about clinical reasoning development, context building. There's a couple of different ways, interesting ways to do that. What we've done with Mary is I said, Mary, let's bring in some of the patients we would have brought in for patient day. Of course, that's not going to happen for a long while, potentially. We brought them into the clinic and we did full evaluations and treatments of them. We filmed all of it, from the subjective to the movement analysis, to the interventions, to the return visits. We filmed it all. And then what we were going to do, so in this segment that Mary's talking about is how she used these initial videos to test out the concept. So I'm going to let her share a little bit about it, and then I will tell you more about what we are releasing that will be even easier for students to develop their clinical reasoning, to kind of model after Mary's clinical reasoning in real live sessions, not, well, the recorded sessions, but real life patients. So let me have her share a little bit here.
Okay, so what we did is we took a look at three different cases. So normally I like to pull a variety of different neurologic patients in, and the students get a chance to do an evaluation and intervention. And it just wasn't possible. And so what we ended up doing is taking a look at basically Roy Trujillo, the same gentleman that you saw with the PNF piece, came on in and we filmed him doing a variety of different activities. These are all the different folders that you see. I'm going to click on subjective and you'll see a tiny bit of the subjective, and it's just as an example. And then I'm going to show you some of the forms that I filled out. And the students basically got to fill out a neuro exam as they were watching the patient go through a variety of clips. Okay, all right. So welcome to physical therapy. My name is Mary and I'm going to be your physical therapist. So tell me, what brings you into physical therapy?
Well, I want to try and stay active. Sitting there watching TV is not a good thing to do. From everything I've heard regarding people with Parkinson's, being active, exercise is just as important as taking medicine.
Oh, I totally agree. So now your doctor mentioned something about a fall.
Oh, yes. I had a fall a while back. I was walking a dog, small dog, about 15 pounds. Just got about a block away from home, and just out of nowhere, a big dog, 70, 80 pounds, coming around this big bush.
Oh my gosh.
My small little dog, and started to shake it. And so in the meantime, I started to kick this big dog 4 or 5 times, and my shoe flew off. And I fell in the street on the pavement, hit my knee. And
okay, so there's a little bit of a mark here, all right, and a little bit of black and blue, so it's resolving a bit. Okay, so it goes on and on. So so each of the different video clips will have different amounts. So we looked at filming 3 different cases that I thought would be helpful for my students. One was a person with Parkinson's. The second was an incomplete Asia D spinal cord injured person. And then the third was a traumatic brain injured individual that was in a coma for a period of time post their traumatic brain injury, so more of a severe condition. So this is penciled in. I do apologize that it's penciled.
Nope, that's perfect. That's great.
But I basically wrote down, so this was going to be, I have 2.5 hours to complete the evaluation or the experience for the students. And so I wanted to go ahead and provide the students a chance to take notes. I gave them a blank neuro exam, and you'll see the neuro exam in a second, and a blank piece of paper that that they could take notes on and then transfer over the information that they had derived. And so I basically came up with a series of things that I wanted to show them. And so it went from subjective to doing vitals in supine, sitting and then immediate standing, to mobility, to looking at range and reflexes and rigidity, to looking at reactive balance, to looking at 10-minute walk test, 10-meter walk test, the tug, a MOCA screen, and then the functional gait assessment. And then I filmed some interventions as well. So LSVT interventions, some power interventions. And so, so what I did is I had a key that I developed.
Little plus, yep.
Okay, so hopefully you guys can see this.
Yep.
So again, I apologize, it's handwritten, but I'm having the individuals fill out then this information so that they can kind of begin to kick the tires on what filling out documentation would be. This could be a paper and pencil less often in the clinic, more electronic, but at least this gave them an experience of the components that would be entailed on that history. So what their current medical history is, chief complaints, past medical history, family, diagnostic tests, and current medications. And then what is their prior, their current level of function, and then patient and family goals. And then from there, I also talk about their home environment. We list the vitals. We look at pain. We look at eggs and eases. We look at the MOCA and where they're at in terms of orientation and cognitive capability. And then I didn't really test these on the film or on the videotapes, but I gave them this information as if it had been collected.
Perfect.
And then sensory testing. What would I perhaps see in a person with Parkinson's disease? And then no, I wouldn't do spasticity. Yes, I would look at rigidity and bradykinesia. And what would I see reflex-wise? Cranial nerve testing? Not really. However, you're going to see a decrease in olfaction.
Let me ask you real quick. So the students also had a blank sheet just like this, and you were watching little clips, and then they were filling it out as though they were doing the evaluation.
Exactly. So I would take them to, okay, we're going to fill out the FGA. And I gave them on Blackboard here. I go here, hang on a second. Here's the MOCA. Here's the Frieza Gait. Here's the FTA. So they had a blank FTA. And so I was showing them the different flips of the FTA, and then they were scoring the different flips. And then we would discuss what they came up with, and is what we did.
Ready, set, go. Fast, slow. Okay, very good.
So little videos like that, and then what would you do?
And then we would pause it, give them a chance to score it.
Okay, now what you're going to do is you're going to carry this cup of water at the same time that you're doing that task, and try not to lose any of the water.
So this is, of course, a different video of a different patient.
Okay. Okay, get ready. Ready, set.
So do the alphabet thing?
No. Just carry the water.
Okay.
Okay, ready, set, go.
So you see a little bit of impulsivity, but a good sense of humor.
That's right. So it really gives about as close as you can get to being in the room doing the evaluation with the patient. And I think what's unique too is that you've been able to capture so much of the subjective, the objective exam, and the interventions that all of those concepts can be linked. And I think that's sometimes very hard to do when you only have bits and pieces.
Do you think?
So
Okay, so
what I was going to mention about that, there's two main things. One is that we are going to create a video library that has the full evaluation and treatment that will be available for you to access as faculty so that you can run the same experience as what Mary has run. Now, the challenge with that is, of course, that you have to run it. The second thing that we've built out of these, we're vetting them as we speak, is we've built these interactive evaluations. I consider them macro simulations. The macro simulations are more narrative. They tie together many different concepts. They're also much longer. So when you think about simulations, you have to decide, how targeted are my sims going to be? Are they going to be short, fast, and targeted, or are they going to be long and extensive, but allow for the narrative story, the clinical reasoning, all the pieces to come together? So if you can imagine, you will watch the subjective, and this is built into a asynchronous e-course, okay? So the student watches this on their own. You just assign them a link, and they will go through the entire evaluation and treatment of a neurologic patient, Parkinson's, spinal cord injured, and traumatic brain injury. There's 3 of them for now. And there are questions interspersed throughout the entire experience. So there's like 8 chapters: the subjective exam, the movement analysis, the assessment of balance, the assessment of tone. So there's these different chapters that the students will go through, and there's questions built in. Some are open-ended questions, some are multiple choice questions. But the student, whenever they fill in a multiple choice question or a open-ended question, when they submit it, they get a voice bubble that shows what Mary was thinking about that same question. So they always get to bounce their thoughts off of the thoughts of the expert. So they will essentially be able to walk through an entire evaluation and treatment, interact with the entire experience, and you don't have to lift a finger because we've built it into an e-module. So let me take a second, actually, just to show you a glimpse of what that might look like. This is now available for you if you log in to PhysioU. Close this down. There are some cases, some mini sims. This is a mini sim, but it's part of the bigger sim, okay? So what you'll see here is a mini experience that we created where we wanted students to be able to perform the timed up and go, be familiar with what equipment you need. And so let me take you there. So this 65-year-old male with Asia D spinal cord injury, you would like to perform assess his fall risk. So we asked them which of these tests would be relevant to do. Then we ask, what is the appropriate setup? So they have to be familiar. They have to have gone through the app. They've already learned this in lab. We're just now drawing the information out of them, because I think this is a very important part of learning, is drawing the information out. So we're going to use a 3-meter path with a chair and a cone. How should the patient begin the test? Well, we want them seated with the back against the chair. In this form, I am just gathering their information and I give them a score at the end. Okay, so in this case, we're using this as a summative experience. How does the therapist accurately record the tug? Well, the time is started once the patient's back leaves the back of the chair and is stopped once the patient's back contacts the chair. I submit, and here we are at the actual test. So it says, click on the video, hit start and stop to start the stopwatch.
All right, so what you're gonna do is when I say ready, set, go, you're gonna stand up using the walker. You're gonna come around this yellow piece, the blue piece of tape. You're going to turn around that tape, come back to the chair and take a seat. Okay. All right. So ready, set, go.
When the test is over, the time matters, because in the next question, we ask them, how long did the patient take? Well, it turns out it was 1 minute and 12 seconds. And then we ask them to interpret it. Given this patient's time, what is your recommendation for the patient? If they don't know how to interpret it, they can view the hint. This comes from their PhysioU app. And then they make their best choice. Patients should use assistance when ambulating in the community. They submit it. And we've added in some movement analysis kind of components. So what kind of movement faults did the patient demonstrate? So they can watch the video again. They can click on decreased hip extension or a number of these different faults. And we ask them, what is a possible intervention that you might use? Oh, maybe I want to do some passive stretching of the hip flexors. So this essentially is the style of interactive mini games, neuro mini games that we've created. And those mini games, just to give you a glimpse, are going to cover, we have 13 mini games that are going to be released by fall: spasticity assessment, rigidity assessment, coordination testing, timed up and go, MOCA, modified Ashworth scale, Romberg and sharpened Romberg, 5 times sit to stand, 10-meter walk, 6-minute walk, and then the Berg balance test. So all of these little games will be available for your students, for you just to assign. Go play them. And then we can talk about it later. Okay. The macro sims, the big narrative sim, will essentially follow the patient all the way through the subjective to the objective to the treatment and the return visit. They will be able to walk through this entire, in reality, it's probably an hour to 2 hour long simulation, which means we've broken it up into chapters so students can do a little bit throughout the week. I think of it as a longer experience, but you're going to do less of them. You're going to do a few big ones, but you want them to see the clinical reasoning that's happening throughout the entire experience. So let me just take a second to ask, are there any questions about that? Any thoughts of whether this would be useful in your classroom? And feel free to unmute yourself if you can. Any thoughts, comments about that?
It's me again, Elaine. Well, for one thing, I'll tell you, because of COVID, I mean, we have a really wide, the room, it's a combination classroom and lab. It's extremely wide, and we have a good mic system, but it's so difficult for every student to see all of the pieces of whether it's an evaluation, intervention. I'm very excited about. I have to tell the creator that I'm truly appreciative that she has decided to include PNF. I'm a long-term practitioner.
Yes.
And the neurodevelopmental options. I am CNDT, and so I think we need to have all kinds of tools, orthopedic, neuro, cardiovascular and pulmonary. And so I'm glad to have those. And PNF, I think it's especially difficult sometimes for students to see the techniques. You're
Right.
trying to show people that are spread out in their pods, very difficult. And then they get home and they don't remember. So thank you so much. I'm extremely excited about the neuro options that y'all are now creating. So thank you very much.
Yeah, absolutely. Absolutely. We're excited about it too. I think it allows us to really explore new ways of helping students experience what it's like to be a PT instead of try to piece it together after we've poured out all the pieces on the table. Does that make sense? Like lots of times we teach all the pieces and then we hope that it comes together. And I think that the future, we can actually drive their reality. We can help them scaffold what is it to become an optimally practicing neurologic PT. And then to be able to then learn all the pieces to fill in the gap. The scaffold's already there. This is what I was mentioning here. You see, this mini game is long, but it covers some common learning objectives. Here's the main menu of the different parts that the student will go through. So you can go directly into stair assessment, gait assessment, dual task tug, standing reach. And when you go to that section, you'll watch the video.
So what you're going to do here is we're going to look at having your sitting posture unsupported. So you don't have armrests. They're helping you out. Okay.
And then they'll move into, after watching this patient complete the dynamic movements, what were some things you noticed about their movement? So you ask the student to reflect. So I type in whatever my reflections are, I submit it, and then there's Mary and her thoughts. Do you see how powerful that is? Now, we realized that there is a fine balance between how much you can draw out of them with these open-ended questions before they're mentally exhausted. So there's a fine balance between these open-ended questions and some easy questions where they can just draw on their knowledge base, choose a multiple choice answer, be told that they're correct, read a reasoning behind why their answer was correct or wrong, and then move on. So you can see that there's a lot of thought and experimentation that's going into the development of this kind of interactive resource. But can you imagine 3 patients, Parkinson's, traumatic brain injury, and Asia D spinal cord injury. This week we are filming with a stroke patient. Imagine that the students can play through this asynchronously. How powerful that is for the scaffolding that's occurring in their mind. So I just wanted to give you a good glimpse of that. So you can go to all these different parts, and then there's questions for us to ask them, to ask the student to interact. And then they get to bounce their thoughts off of Mary's answers. Now, in this last couple of sections, because I know we're beginning to run behind here, I want to show you the Developmental Milestones app and the Pediatric Gait app. So let me just take you very briefly right into the apps here. So I'm going to go right over here. If you go straight into the PhysioU apps, and I'm going to sign in, and I take you to Developmental Milestones, you'll see that we basically filmed, besides month 0, because we were too late for that, month 1 through 12 is the same child. So you can watch how the baby is in prone, help the students make observations about what is common for this month of development, and then what are some things that may be atypical that you should be watching out for. And then you can skip into different positions. And then you move into a different month. And now you can begin to see how the baby's changing. So there's value alone in just watching the same baby changing over time. So I think that's quite powerful. There's also reflexes that we filmed. So all your common reflexes, examples of all these common reflexes are now filmed for you, including the stimulus, the response, and then the appearance and integration. If you go further into the app, there are a bunch of case studies. So what we've done is we filmed a bunch of different children doing different things, and you can use these to use these as activities, because the students will watch the video and they will write down what their observations are. And then you as the instructor, now they can look at the answers too. We've written the answers here for you. Eventually, in the next version, I will hide these answers so that only when faculty log in do they have the ability to open these answers. So you can lead the discussion here. What is the functional age? What is the actual age? What is the diagnosis? And what are some potential short-term and long-term goals? So you have all of these little cases that you can utilize, different children, for all of these different little movements. Okay, so that's another way to use this in the classroom. And we have standardized testing. What we've tried to do here is just bring them all into one place. You can look at, based on diagnosis, the common standardized tests. Of course, many of these tests are proprietary, so we direct you to where you would buy them, but we provide basic information. What's it for? What age group? What are the psychometrics? And we direct you, of course, to the most updated information, the SRA labs, so that you can get to the information that you need and go more extensively into the actual instrument. Okay, so that's the Pediatric Developmental Milestones app. And in partnership with also what we use this year in our PEDS class, we use the, this is a collaborative effort between University of Idaho and PhysioU, where we created a Pediatric Gait VR app. So let me show you that here. When you log into this app, you get to choose different children with different developmental problems, neurologic problems. The students will then fill out this Edinburgh Visual Gait Score. So it's an interactive worksheet. So they can use their goniometer, they can stop the video, they can rotate the video around the patient to get a different view. And as they are scoring it, at the very end of the game, there's a key that helps them to see what are the things that actually they scored right or wrong, and they can go back and reanalyze it. Okay, so here you are. Why do we think this is valuable? Because it augments reality. It helps students see movement patterns common with hemiplegia, with cerebral palsy, and it helps the students actually do this very high level skill of visual movement analysis. And it simplifies it a little bit. It allows you to stop the patient. It allows you to slow the patient down. So all of this is helping our students take one step closer to being able to do this in the clinic. So this is available for you. The student, you can assign it as an activity for them to do on their own or in class, and they can turn in a screenshot of how they did. This is, we're almost done filming activity analysis. It's essentially functional movement, okay? So let me give you a glimpse of what this looks like. So this is Andrew. We filmed a bunch of functional activities. This was the first iteration of what we thought this app should be like. But in careful consideration with a number of faculty, we decided that it was best to film all of this in the patient's home. I think you would agree, because much of what these patients need to do, they need to do in the context of where they live, what occupation they are in. So what you see here is activity analysis. What we did is we filmed the most common tasks for a whole bunch of different patients. So for example, here's feeding. Now we film me as the typical, so-called typical. And what you'll see then is multiple views of me dressing, showering, brushing my teeth, shaving, donning and doffing of clothes, getting up, getting on and off the toilet. All of this has been filmed from multiple angles. So you have a typical video that you will be able to reference. In the master class, meaning the flagship videos, we have actually done the analysis for the students. And then there's a whole bunch of videos that no analysis has been done. It is purely for the instructor to utilize in their classroom or as homework for the students. So here's the front view, here's the side view of the same task. So you can switch from front to side, front to side. And you'll also see that we created a SOAP note for this initial masterclass flagship video. So students would learn how all of this is documented. If you go further in, you'll see activity analysis practice, which means here are the different patients: female typical, male typical, female, a new mom with de Quervain's tenosynovitis, a male with spinal cord injury, Asia D, a patient with right total hip arthroplasty, status post right total hip, a patient with COPD. So you will get to watch videos of how he performs his dressing. And the students will then go about doing their analysis. So remember, we filmed John here doing cooking, cleaning, dressing, showering. We filmed it all. We filmed almost the same set of videos on every patient. Here's a wide view of him performing the same thing so you can get a closer up view. And you can see that as we move into total hip arthroplasty, we have videos of dressing, right? So you can watch videos of the patient dressing, trying to maintain his total hip precautions. You can see videos of the patient, I'm going to show you here, performing some leisure activity. All of these are the things that we want our students to be able to think through, to process and determine what impairments do I need to manage to help this patient achieve, right? Achieve the task that they want to be able to do for their life. Any thoughts about this? Any comments? Okay, so let me just finish up here. I know everybody's getting ready to finish up. So lastly, I want to just show you a glimpse into the Neurologic Rehab app. The task analysis app will be ready by fall. Okay, so just so you know, we have 2 people left to film, and then the app will be ready. The Neurologic Rehab app, you can see, goes into a collection of really cool different components. So you get to it through our apps system here. So if I go back to here, PhysioU apps, I can sort these apps by topic area. So here's neurologic rehab. Here's neuromuscular rehabilitation. And in the video library, you'll see that there is a full evaluation. In this full evaluation, you can have your students actually engage with this content. There's a quiz that's built in. So the students watch the patient interview.
Hey, hi, Malika. I'm Sara. I'm going to be your physical therapist today, and I wanted to ask you a couple questions before we get started. Is it okay? Yeah. So what is your whole name?
So they watch the subjective and they go through and answer a bunch of questions. So they will experience, Sara uses this at the beginning of her neuro rehab class. And essentially the students do this the first day of class to get a sense of what a neuro eval looks like. And so as they begin to answer questions, they'll begin to get feedback. So this is not necessarily something that you have to grade. Sara does get a grade sheet out of this, but in general, we use this as just a formative experience. Let them walk through and interact with the content. From here, you also have, so you can see in the eval, there's gait observation, range of motion and spasticity testing, different objective outcome measures, right? These are all the different parts of the test that she did with the quizzes. Okay, so this is something your student can already walk through on their own. Then you can look at the interventions. She's organized the interventions by bed mobility, seated posture and mobility, transitional movements, standing, gait. And so here in bed mobility, you can see all of the different techniques available for the students to look through. Okay, so this is all the intervention techniques. And then recently what she's released is in the case studies, she has a number of different videos she's taken. And then She's also created these little helper question sheets. So case study 1, here are the student questions that you can download. And this gives you the history and the questions that she uses in class for case study 1. She is busy building a bunch more of these to help the faculty to run these interactions in their classroom. So you can see there's essentially the basic history, the occupation, the chief complaints, and then some key questions that the students are asked to discuss. So that is now available. We just recently released that. So that's the NeuroExam, the Neuro Rehab app. She also has an outcome measures toolbox. Let me see if that goes. So she's listed a bunch of easy to access outcome measures. And I think also she has listed a bunch of really good resources, available resources. Okay. So they're essentially lots of different commonly used, commonly available resources, all aggregated in one place. Okay, so I think in closing, what I would say is that we have a lot of different apps. The neuroanatomy app, I don't have something to show you quite yet. You will get an invite when we have the first beta version to release, but you can see that neuroanatomy is coming. The task analysis, activity analysis is coming. You have a number of different apps that you can utilize in your classroom. And what we're up to, we're filming a ton of neuro evals, neuro treatments, and interprofessional patients, management of patients from an interprofessional perspective. So you can see we have a list of diagnoses that we are trying to capture in different settings. Some of it's acute, some of it's outpatient. And this is us filming in our studio. This is our treatment, kind of our acute setting. And we have OT, PT, speech, she's a speech therapist, physician, nursing, everybody evaluating and treating this patient. We are turning that into an interprofessional experience where you can learn about how each of these professions play an important role in the management of real neurologic patients. So that's coming. And we've created these mini games that I've shown you, the tug mini game. Ultimately, we're looking to do some updates to the NeuroExam app. One of the reasons why we're filming all of these patients is because eventually we'd like to put typical and atypical in the NeuroExam. And pediatric interventions also, we are getting ready, gearing up actually to film through the rest of summer to film all the common pediatric interventions. So I hope that gives you a quick glimpse of how potentially to use the PhysioU apps in your classroom. And I'd like to just open it up for your thoughts, your comments. And always, if you ever have questions, to be able to feel free to reach out to me. We could always schedule a one-on-one call. But yeah, any thoughts or comments? From the group? Any questions about how to access the apps? How do the students access the apps? Any comments? Thanks for your comment, Kimberly. So just so you know, all faculty should have full access. I hope all of you are able to, over this summer break, play through some of the apps. You should be able to, you have your own login. And Donna, these, there are instructions on the web for how you can put the app, the web app, on your phone. So for example, on my phone here, which you can't see very well, you can save the web page as an icon, and it essentially will open up the browser. And I can log in and it'll remember my login. And then the entire app family is on my phone, on my iPad, or on my mobile device, any mobile device or laptop. So yes, remember that you guys all have full faculty access. You should be able to play through and utilize this app in your classroom. All we ask is that the students, if you choose to use this, that eventually they get their own subscription to access all the content. That is what supports us paying for patients to come in, to pay for filming, to create all of these apps. But yes, please feel free anytime to reach out. Our students want it on their phone. Yes. So Donna, I'm going to send you a link. There's a link here. Actually, I'll show you for those of you who are still on. If you go to PhysioU under, I think under knowledge, at the bottom, there is a frequently asked questions. Can I use this web app on my smartphone? And there are instructions here on how to do it. So how to log in and save this app as an icon onto your phone. So James and I are free to chat if you have any other comments or questions, any thoughts, any questions about what we're doing or.
I have a kind of a comment / question for
Sure.
the participants. One is it was funny. I was at a Con Ed course, whatever. They said that if you're over 40, you go to your bookshelf and look it up. If you're under 40, you go to your phone and you look it up. It's funny how the different generations are all your students very comfortable, and this for the participants. Are your students comfortable with this kind of virtual learning activities? What is their, I mean, old school for me, you show up at class every day and you have your net textbooks. So I wonder if this, this is just now the norm for these students. This is how you learn.
That's right.
And anything programs not having this, it's kind of like, wow, you get to do that. Our guys aren't doing that. It's a norm. Thanks, Donna.
Yeah.
Yeah.
Great.
Yeah. I think textbooks, one of the first conferences that I worked with PhysioU about 3 or 4 years ago, one of the guys came and said, I got rid of 2 textbooks because it almost pays for itself. And that the other thing too, I find that students, they're doing a neuro rotation, but then there's an orthopedic condition, shoulder issue with a spinal cord folk. Well, it's still all on their phone. They can just look it up real quick. They don't go, oh, I left my ortho binder at home. I didn't bring it to my site. So, yeah. And so, yeah. And the one comment I make, it's critical a little bit, students, but they don't want to be educated. They feel like they need to be entertained too. I know I'm sounding a little disingenuous to the students, but I think that's kind of what they also like doing too. And it keeps them engaged in the process. So more power to make them enjoy learning.
Yeah. And I would say that the other unique part of this so-called resource is our students start with it on the first day of class, and we use it throughout the entire program. So I can reference back to range of motion MMT anytime. I can reference back to the modalities, physical agents anytime. I can reach forward to therapeutic exercises that I haven't even taught in class yet. I can show them because it fits that moment. So one key recommendation I would have for you as faculty is to think about your content area. Let's say you're teaching peds and you said, I used to have to use videos of my own child or a cousin or a friend's child. Now I have this uniform resource that's already organized that I can now leverage and make my life more efficient and make it easier for students to find the content. So you pick and choose based on your content area, something that you've been wanting to improve in your course. And then you look through the app and figure out if there's a good match. At the very simplest version of using PhysioU, you could think of it initially as a library of all the common examination and treatment techniques that you're going to teach. But it's organized and it's always available on your computer as well as on their devices. So there's no disconnect. You don't open up your Google Drive and dig around for videos. You don't look around on Netflix or on YouTube anymore. This is a stable, high quality education-based platform. The second thing you can do, I think, is to think about how do I make worksheets that leverage this content? So if I have worksheets that can tie into the videos, great, even better. Your worksheets just became really, really cool. And the third thing I would say, which has been our focus since actually prior to the pandemic, is some of these interactive e-modules that we'll be releasing now become your best friend. They are asynchronous, they are scalable, they are tied to expert clinician clinical reasoning. Those things you will see will actually help your students sort through all the volume of content and learn how to utilize it better. I don't even think we understand the ramifications of having this type of resource yet, but I'm having the time of my life working with professors from all over the country, thinking through some of these projects and then exploring what the new generation of learning can be like. I really believe that in areas of medicine, in areas of rehab, it is very helpful at the beginning of any clinical class to see how a clinician does their thing, does the evaluation, links treatment, links the interventions to the impairments, links the impairments to the functional limitation. So all of these concepts you can see that are coming out as product are all tied very deeply to one, CAPTI standards. So James is working together with Manny, one of the other founders, in putting together a document to show that we have mapped out many of our apps to the CAPTI standards, though the standards are often very broad. And also that we are building a lot of simulations and mini games, mini interactive things to make learning, whether it is hybrid, whether it's face-to-face, whether it's completely online, if that should ever occur, that PhysioU can be a supporter of student learning and faculty efforts. My goal is so that faculty don't ever have to reinvent the wheel. We can just build a really good wheel and share it with faculty, being James and I being faculty ourselves. So I hope that's useful to all of you. This recording will be available if you want to share it. We will be sending a copy of it to you. It will be also hosted on our website. You can always look for videos about more different content areas. Again, here under educator, faculty resources, there's a bunch of deep dive webinars here. So you can watch our recent simulations video, more about acute care. We're doing another webinar at 11, a PST about acute care and cardiopulm. But I hope this is really useful for you. And I also hope that you guys get a great moment of rest and that you enjoy some time with family or doing whatever you enjoy so that we will be recovered and ready to take on another eager group of new students come fall. And Elaine, for you guys in the trenches now, keep up the good work. Thank you, everybody.
Y'all be safe.
Yes, be safe, everyone. Take care.